Neither the El Paso County Medical Society, its members, nor KCUS TV shall be responsible for the views, opinions, or facts expressed by the panelists on this television program. Please consult your doctor.
Good evening. Tonight we're going to be talking about what you may have talked about 20 years ago in medicine in the future. Tonight's program is about telemedicine. What is it? How can it help you? What exactly is it when it comes to technology? And where are we in El Paso with this type of a situation of seeing one's doctor? As you know, this is a live show, so think of some questions that you want to ask us this evening. The telephone number is 881-0013. We are also streaming live on Facebook, so if you don't have a TV close by, but have a pad or a computer, or if you're leaving, feel free to ask us your questions live on Facebook. They will come to us through our Paul L. Foster, Texas Tech Paul L. Foster School of Medicine medical students. We have two to man our phones this evening, and I didn't write you guys down. Who's over there? Aaron Pines and Alyssa. Aaron and Alyssa are here, and they're going to be answering the phones, and then they're going to bring the questions over our way. So thank you very much for that. This program is underwritten by Sunset ID and also Ve Mi Doc, and which means see me doctor in Spanish, which we found out just a couple of moments ago. So thank you very much for underwriting this program. There's going to be a lot of information that we're going to learn. I always look at you as the futuristic guy. It will always be that. We've done it a couple of times. I like it. The El Paso County Medical Society brings this program to you each and every month, sometimes several times a month. I'm Catherine Berg, and you're watching the El Paso Physician. Thanks again for joining us. Have you ever seen a doctor via your telephone, which happens to be a camera, which happens to be a TV, which happens to be a diagnosis type of a situation? We're going to talk about that this evening, what's good about it, what people have some leeriness about it, but we're here to clear a lot of that up. With me today are two of our veterans. We have Dr. Aldo Maspons, who is the CEO and founder of Ve Mi Doc. He's also, you may recognize him, he was a gastroenterologist and specializes in pediatrics. And we also have Dr. Alozzi here, who is the CEO of Sunset ID Care, and he's been on the show before for infectious disease, and he's got all kinds of board training. It's crazy. You guys know everything. So it's great to have both of you here to talk about telemedicine.
Definitely.
Telemedicine on the borderland. So even though I've described quickly, Dr. Maspons, what your specialty is, kind of, if you don't mind, with the audience. So it's going to be a little bit different than most shows. Usually I say, hey, what do you do all day, every day? But we know that you're a gastroenterologist specializing in pediatrics, but this is a whole new way of dealing with medicine.
That's
so
right.
Why and where did you start being a gastroenterologist for pediatrics and then go into this world? And that's going to be the same question for you too, Dr. Alozzi.
So I'm born and raised in El Paso, Texas.
Yay!
And my grandmother had cholangiocarcinoma, and she helped raise me along with my mom and my sister. And so she passed away pretty early in my life, and it was really impactful for me. And so, I wanted to do something to help her, people like her.
Right.
And we went a lot to Thomason, and so I developed this affinity for being in the hospital and taking care of, and just being around sick people and loving that life.
I like how you said taking care of them. You stopped yourself, but taking care of them. That's good. Yeah.
And so fast forward like, I don't know, 30 years or something, and I became a pediatric gastroenterologist, and I was moving back home with my wife, and she's a pediatric hospitalist. And so my niece was also moving back from San Diego. My niece has a lot of medical problems. She's a special needs child. Mm-hmm. And I wanted to figure out a way to help kids like her and kids like her and families. When my sister and my mom get my niece ready to go to a doctor's appointment, it's like a 4 to 5 hour time investment for maybe a 5-minute visit.
Right.
And kids with special needs, kids in general, right? If you mess up a kid's nap time or snack time or something, it's a mess. Mm-hmm. But with kids with special needs, it's that much more delicate, right? So if you have a child with special needs who's in the waiting room, it can be pretty stressful for that child and the family.
So time is truly of the essence in a situation like that.
And knowing that as a community we're very underserved, we need to find ways to scale healthcare. how do we multiply physicians?
Exactly.
And so I along with my two other co-founders, I'm co-founder, CEO and co-founder of VemiDoc. VemiDoc means see my doctor in Spanish, VemiDoc. And so we developed a telemedicine platform. Our mission is to modernize the patient-physician relationship.
Right.
And so what we do, and I use this in my practice, especially for kids with special needs. So we have one example is a child I had who I was taking care of, and he only had a certain number of ambulance rides. And he was
insurance-wise, insurance would take care of.
That's
Gotcha.
Right. And so for me in my office, before I really understood this whole dynamic, they would other patients like him would go into an ambulance because they were on a respiration machine. They would breathe for them, and they would bring the family and the child to the office, and then we do our thing, and then 5 minutes or however long it takes them longer to get out of the ambulance and everything to do the visit. And that was it. And then I became sensitive to, no, this is a really difficult situation for everyone involved, not me.
Right.
I have the easy part of this whole process. And
well, what I love when we do these programs is that we talk often about the teams that we have on the program, but where I try to come in is humanize what people call, the medical show or the doctor show. If you don't humanize it, then people don't get it. So I love everything that you're saying right now, because you are bringing it from a doctor level to how is it affecting your particular family.
That's right.
You're the doc, fine, the white suit guy.
Yeah.
Now it's your family, now you're looking at other people. And the reason I want to talk about this, because when I do these shows, I always try to pass it by people in my office. I work at the Community Foundation. Everybody that's on the air here today, we're volunteers. So I try to pass it by people and get questions from them too. It's like, well, what does that mean? You mean they can diagnose you here and there? And Dr. Alozzi's got a situation currently that he's undergoing that he used this for. So you then, co-founder, how old then is VemiDoc in El Paso?
We're 2.5 years old.
Okay.
And we've made a lot of great impacts directly for my patients. So we've done visits with children who can't get out of bed, who need these ambulance rides. We've kept patients out of the ER. We've decreased hospital stays. I've done consults while I'm away traveling for my patients while they're in the hospital. And it's all about connection, right? So the more connected I can stay to my patients, the more likely their medical outcome will be great.
Nice.
Not that I'm an awesome physician, but just that it's part of the team.
Right. You're not forgotten for a month because that's the only time you can. And insurance is a big thing. I try not to address it on the program because you're docs and I respect that. But again, that's part of real life. Dr. Alozzi, let's kind of take that same idea with you. So you're infectious disease. You've got a lot of other specialties. But here today, we're talking about the CEO of Sunset ID Care. Number one, what is that?
Yeah.
And number two,
sorry.
how did you get into this? No.
Yeah. I mean, so we've been together before. Aldo's my friend. This is great having us. I think from a sort of global standpoint, what is Sunset ID Care? It's an infectious disease clinic here in El Paso. It provides care to well over 1,000 people living with HIV here in El Paso, Juarez, and Las Cruces. Been existing since 2014, and that's really the focus of that. I think where that comes into some of the conversations about telemedicine is I don't have the kind of story that Dr. Maspones has, but one of the things, and this is possibly selfish on my part, is as my practice was growing and I was getting more and more clients into the practice, realizing that majority of our new patients coming in with an HIV diagnosis were around 25 years old. They behave
under 25 years old?
25 and under,
Goodness
on average.
gracious.
Average age is about 25. They behave very differently than my clients that were coming in for hepatitis C, hospital discharges and such that were around 52 to 56 years old. One thing is that they didn't want to come into the doctor.
Of course.
Right? There's data everywhere that shows that millennials and below do not want to have a direct relationship with their physician. That's not their priority in healthcare. Their priority is niche medicine, doing little things to stay well, get well, be well. Right? And so my older clients that had hepatitis C, they would come into clinic all the time.
Right.
They wouldn't miss appointments. We'd cure their hepatitis C at a 98% rate. The younger clients, however, wanted a different alternative mechanism to engage with the clinic. They wanted to send a text message. They wanted to get on a patient portal. They wanted to engage with healthcare a little differently. in my former role as the Chief Health Informatics Officer at Texas Tech, it started to get me thinking, right, what can we do on a systemic basis? And so back in 2013, 2014, we actually launched a text messaging service, right? And we showed that by using text messages to send patients 72 and 24 hours before an appointment, 72 and 24 hours before they were supposed to pick up medications, we were able to reduce no-shows by 50% over a 12-month period.
Goodness.
Right, it's that
Okay.
some of that learning that I've taken into the private practice and sort of driven that teachings around the state of Texas, where I do a lot of consulting around HIV and technology. And I think the important thing about healthcare in 2019 and going forward, and telemedicine is it's not replacing anything that we do presently.
Exactly.
It's changing the dynamic. There are people that are always want hands-on, right? They're going to want that interaction face-to-face, physically with their physician, provider, whomever it may be, and there are people that don't want that,
Yeah.
right? Some of the conversations we've had before is, if you're coming from Horizon, for example, and you need to drive to a physician or a medical center that's downtown, that's a 40-minute drive,
Right.
right? And if
Right.
in our traffic, it could be longer. Then you figure out parking, and this is whether you have special needs, disabled or otherwise, parking 10 to 15 minutes. You register in the
Right,
clinic,
right.
right? Waiting room is aptly named because you wait there literally forever. The average wait time in El Paso is about an hour and a half.
Right.
And so then you see the physician clinician, and it's a 5 to 10 minute visit. There's no other industry, there's no other place in our lives that we would put 2 hours into 10-minute bang for your buck and accept it as normal, right? And I think we can do differently. I think what Aldo mentions as well is the fact that we need to find a way to catalyze the number of clinicians that we have in this society. Right? There aren't enough doctors to treat everybody.
Right.
There aren't enough nurse practitioners, PAs,
Ongoing
whatever we
issue in El
want to
Paso.
call them
Right,
to
yeah.
treat everybody. And if you just take the economies of scale around those numbers that I mentioned and say 2 hours to have a 10-minute visit, what if you could do that at home?
Right.
And then multiply 10 minutes into that 2 hours, right? Immediately, that's 12 visits instead of that one visit and all the wasted time, the economical resources, the clinician time, the patient time that's wasted. And I really think that's what telemedicine can bring to the table. I also think, those parents and persons at home that have teenagers, when was the last time you called your teenager and they answer the phone? Right? They'll text
Exactly.
you, like, what's up?
Dang it, I'll
What's
text you
going
4
on?
times. Now answer
Right?
the phone.
And
no,
again,
I get it.
like
Yeah.
I tell people, it's not for everybody, but it has to be a mechanism which small groups, big groups, massive groups, the tenants and HCAs need to start to pivot healthcare because millennials are the largest part of this population.
Right.
And they're taking care of the baby boomers who are their parents and potentially aunts and uncles, right?
And
So
like
if
you said, it's a systemic
Yeah,
change, a
exactly.
systemic basis change.
Exactly.
I'd like to talk about exactly what it is. So let's look at what the KCOS TV audience is. So this audience in general skews older, it skews more educated. So let's look at the fact that we probably don't have a lot of millennials watching, but start tuning in. You're getting older. So let's look at grandma or mom and dad. And I'm a little bit, I don't know if I want to do it that way. And I want to, again, I'm a fan of this very much. And it's not that you're taking away the touch. It just happens to be the touch is there, but the 4 or 5 other times that you need to somehow integrate some kind of advice, that's there as well. So Dr. Maspons, let's talk about so you're 2.5 years old, you, meaning your business,
company.
technically, the
That's
company is. What was it that you were getting as far as like, I don't know if we can do this in El Paso, or is this gonna work? Or what was it that was exciting to you? It's like, this is gonna work because, what's the feedback that you got one way and the other from putting together this business?
I think so. It depends who we're talking to.
Right, exactly.
And 2.5 years ago, it was a difficult conversation because it's hard to imagine these kinds of things, right? Everyone wants to be in front of their doctor. And slowly, as the technology starts rolling around, and slowly as people start becoming more amenable to using their phone for all kinds of services, then these things make more sense to people. And Skype is the common thing. Right? People are like, oh, it's like Skyping your doctor. And so in VemiDoc, we would always get that from physicians. They would say, why can't I just Skype?
Right,
Just
exactly.
Skype? And the issue
So
is...
you have been asked by patients, why can't I just
Yes.
Skype you? So this is a beautiful thing. And this is what I
Yes.
want to bring to the patients at home or to the audience at home, that this is not something that the doctors are, I mean, patients are very curious. And also it's a huge time saver. When you said 2 hours, number one, if you have availability to a car, which is not always the case, then
That's
you've
right.
got the bus system, the bus route, and or Uber or Lyft, and maybe someone who has to drive you if you're not able to drive. So there's a lot of that that's in here too. So again, I'm trying to look at all the positive stuff that goes into that.
Yeah, and so people understand FaceTime, people understand Skype and Facebook Messenger, and the difference is for a few things. So as a physician, I love all my patients, but I don't want them calling me all the time.
Right.
And so for our platform, you can download it on the Apple App Store and Google Play Store right now, and it's available for your phone and your tablet. And if you download it, and you can book an appointment with me or all the physicians that we have on the platform. And so it's HIPAA compliant, so there's some protection of the information. So whatever the information goes from the patient's phone to my phone, that's encrypted and it's protected.
Good. Okay.
Different from Skype.
Right.
And for us, it's a one-way call, so the physicians or healthcare providers call the patients. And it's different if it was a Skype call or a Messenger or FaceTime. Patients would be able to call us, and then there's the liability thing.
Right, exactly.
Like, hey, I called the doctor and he's not answering the phone. What's going on? So it's different, and
So it's still an appointment.
It's
You're
still an
still
appointment.
keeping an appointment.
That's right.
Okay.
And I've called patients. So the relationship has just completely changed. So I've called patients in my car when I'm at the park with my kids. I'm in the garage, or it's anywhere, and patients are. They're in the kitchen or they're doing their thing. And it's a lot more of an efficient and happier visit because they're not on my time.
Right.
I'm sort of on their time. Like they booked a point, we have a mutual agreement on time.
Your time is 10 minutes, to them it's 2 hours.
Yeah.
Very different scenario.
And it's different.
Right.
Now they're at home, no, it's fine, take your time. And it's just a lot more to the point. And the satisfaction rate just is enormous. And we've had, so you're talking about age differences. We had a child, so I had a child I was taking care of, and the grandparents were in town, and the parents left, and this kid needed medical attention. It was pretty easy, but...
And if you don't mind, we are not giving any names here.
Yeah.
But I think the more specific you can be about
Absolutely,
the attention,
yes.
like what did this child need, be specific, because they're not going to...
So there was a feeding tube that this little person
Okay.
had, the little kid, and the tube came out.
Ah.
And so normally, prior to us being here, that would have been, and this was in New Mexico, so this would have been an hour-and-a-half drive,
Goodness.
ER,
Right.
and at least $2,000. So what did the grandma do? The grandma called the parents like, call Dr. Masponza of Doc. They booked an appointment, and the grandma had her grandson with the phone. The grandson was the one booking the appointment.
Nice.
And did everything.
Okay.
And I was talking to the grandma and the grandson, and we exchanged, we put a new tube in her
So grandmother
granddaughter.
and the boy
Yeah.
put the tube back in
Yeah.
on their own with your direction,
Yes.
tell them what to do.
Yes. 20 minutes
Perfect.
versus $2,000 and 5 hours.
Right.
And everyone won.
And everyone won,
We look
exactly.
for situations. So, I said at the beginning, I'm born and raised in El Paso. We're local, and we want situations where we're working together and where everybody wins. And one of the important things in us being a startup company from here is that we really understand what the community is, who we are, and we don't want, I feel, other outside physicians coming in and doing this for us.
Right, right.
Because that's what's going to happen.
Yeah.
And this is part of the conversation I'm having with physicians. Is physicians in the beginning just didn't, well, you're biased because you're trying to sell this, product. I understand, fine. But there's patients that are booking appointments on another type of technology, and they're seeing a physician in Dallas.
Right.
And that patient's not coming in to see you.
Exactly. Right.
And you had no idea that you just lost that patient.
And not just losing the patient, it's in the community too, where people have their support system. And Dr. Alosi, I'm gonna deviate a little bit from questions because I had some really nice backup material from you that there was a press release and there was a grant that was just under $500,000 from the United States Department of Agriculture, and it's to be used for telemedicine services around areas where there isn't a hospital right around the corner, or there isn't. Talk a little bit about how the buy-in is throughout the entire medical community, is entirely, and again, I look at you as future guy. I think was it you and I that talked about bones and Star Trek years ago?
Yes, we
when
did.
you take this and it's like, okay, I've just diagnosed you and you're fixed.
tricorder.
I mean, you're that guy. I remember you being that guy. But we're kind of getting closer and closer to better diagnosis, quicker. Yes, there is hands-on, and I respect that, and there's nothing to be taken away from that.
Totally.
But let's talk about this grant and how is it that this grant even is out there if other people who are the decision makers don't think it's important enough?
So I wouldn't focus in on the grant just specifically. I'm no longer in charge of that grant. Like I said, I'm the past Chief Health Informatics Officer, and so you were with my successor, Dr. Delamora, a few weeks ago.
Exactly,
so that's going to be his sort of foray to go into, and so I don't want to speak for what the university tends to do with it. I will talk about the bigger concept of why telemedicine is important and why it's become an issue that the USDA, Health and Human Services, a host of organizations that are federal, national, local, and state are looking at, right? And the reality is this. If you think about, I think it takes about 6 hours to get from here to Lubbock, driving. Think about the breadth and distance of that. Right? And if you've ever driven
and
it
all
before,
the communities in between.
Exactly.
And that's what this is about.
And this is the key with those groups in between. So if something happens to them, they have to make a decision, right? Do they drive Lubbock or do they come to El Paso? The two level 1 trauma centers that are within their area, right? The question then becomes, how do you stabilize that patient? How do you make a decision on whether that patient even needs to go to a level 1 trauma center, right? How do you get the information that's needed by the receiving hospital, the receiving physicians, about what that person has, right? And so that comes into part of this. There are communities, I think San Antonio has started this, or a couple of communities across the country that are using telemedicine within their ambulance rides. So once you get into the ambulance, instead of just running the code and doing the ABCs, the first care, the first level of cares that happen in an ambulance, they're having a direct communication with the ER doc or the ER team and saying, this is what's happening from a hemodynamic standpoint. Patient needs blood, they're crashing, do this, do that. So by the time the person hits the ER, they're ready to go, right? They're not catching up all over again. And that's a high level explanation, right? What if the person that comes in with a fracture? Or if you're driving from here to East Central Texas and you have a car accident middle of the way, right? I can't remember what middle of the way is right now, but middle of the way, there's no trauma center there, right? And so some of the conversations that El Paso has had, that Lubbock has had, is how do we create a telemedicine network so that wherever you are, whether it's in Alpine or wherever that may be, you can telemedicine a physician here and start to have that conversation and make a diagnostic decision about what needs to be done.
Right.
And so I think that's from a policy standpoint, that's from a sort of citywide, statewide standpoint. And then making it more personal again is, you talked about SKUs older, SKUs probably more insured. I mean, I think it's really simple. Sometimes you may need to go in for the first time, right? You may be 52 years old and you realize that you have diabetes, right? It's a scary time. Diabetes isn't anything that anybody wants to have. You go in for the first couple of visits, things are going well, maybe they're not going well, right? But again, let's go back to that time efficiency.
Right.
Does it make sense when your diabetes is beginning to be under control, maybe you're on 1 medication, 2 medications, maybe you do have insulin or not, do you really need to go into the doctor every 90 days? Right? Can't
or do you just have that conversation?
Yeah, do you have a telemedicine visit either with the physician or the diabetic nurse manager or whomever that person may be to improve your health? I think we have to start getting away from healthcare as a quarterback sport, right? So historically we said we are the quarterbacks and we manage. And there's still some reason that makes sense, but it's still a team sport. Right. And maybe it's not football, maybe it's soccer, where everybody has a role to play, and you can't score a goal or defend a goal unless you're acting as a team, right? And everybody has a role to play in that team, and if somebody slacks off in their role, the team gets weaker. But the goal is to improve patient care globally. And I think that's really what this does. It gives people options if they need those options, and those that don't, that's fine as well.
Do you find that either with this or just with generationally that people are becoming a little bit more self-advocate types? You were talking about millennials and the idea that they don't want to physically go in and talk to the doctor because it's to them, it's so much better and it's easier to do this, and I'm not shy and I can. On that note, you have to be a little bit more educated and self-advocate to be able to do this telemedicine.
Fair enough.
So when you're talking about a systematic approach of the generations, and let's just say that, let's talk about 4 generations. I am 52. I have a daughter who's 22 and a son who's 16. So soon they will have babies. So soon I will be the grandparent. Unfortunately, I don't have my parents anymore. They're gone, but very many people in their 50s also have their grandparents. So now we're looking at 4 generations, to go back to your point. So when you're looking at telemedicine, sometimes it's about my kids' generation educating grandma and grandpa and then great grandma and grandpa. Why am I bringing this up? Because when we're looking at who the caretaker is in the family these days, soon there's going to be a shift. Right now, the majority of the caretakers are those in their 50s and 60s because they're taking care of their parents and they're still kind of taking care of their kids and then the grandbabies. That shift is going to happen in my family and people who are in their 50s in about 10 years. So we're talking about the 30 and 40-year-olds that are really starting to come on board with this. The reason, again, I'm talking about that is that systemically, and Dr. Massapones, I'm going to ask you, because you right now are dealing with, not just right now, but again, you're peds. So do you deal mainly with the 50-year-olds, with the 70-year-olds when it comes to the caretaker of the children? And how are they taking on the idea of telemedicine?
So it's all ages. So it's the teenager. Maybe it's an 18-year-old or 19-year-old.
And are they making their own appointments for themselves? I guess
Yes.
that depends on policy as well,
Yes,
too. Okay.
They are.
Okay.
There are young moms or young parents, and then sometimes there's grandparents who are just really involved with their grandkids, and so it's I get to see in my office and just in pediatrics in general where everyone's involved because everyone's taking care of this one child.
Exactly.
And I think from a concept standpoint, it can sometimes it's initiated by parents, by their kids, and sometimes it's from me or my staff or other physicians who are using our platform, using it too. That they're telling the patient, like, this is what we're doing, and then they're open for it. And if it comes from the physician, a lot of times it's trustworthy, especially when there's a relationship.
Exactly.
And I think it just depends on the patient. Not everybody is going to like this. You know, some people we've never met in person, yet we do visits this way. I did a visit for somebody in Juarez recently, and it works for them. But maybe it's not for everybody, and they want to just come in.
Right.
But there's a level of accountability that I think is really important, that they can come and see me.
Let's talk about that. So on that note, do people, and pardon my ignorance on this, I just don't know, is the patient-doctor initial visit in person, or it does not have to be? Could the initial visit also be telecommuting, so to speak?
Yeah,
okay.
It didn't used to be. So in Texas,
Okay.
it took us a while to get here. In Texas, before a couple years ago, we had to see a patient-physician relationship had to be established, and it had to be in person.
Okay.
And then after that, we could do visits via telemedicine, via phone to phone. Now, the patient-physician relationship can be established phone to phone.
Okay.
So if you're at home and you book an appointment to see me, then that's the patient-physician relationship.
Okay, because we know that's your specialty, and this is my issue, and he's the guy I need to talk to
That's right.
anyway.
That's right.
Okay, nicely said. Dr. Elozi, so let's talk about your knee, because he jokes, you know, there's a guy with crutches, and I'm like, who's the guy with crutches? And there's another guy wobbling in here. He finally gets in his chair. It's the perfect space. He's like, done. And I said, hey, was there any like telemedicine happening so you had a torn meniscus?
Yeah, I tore it in May.
And you said, what, 8 days, 18 days, how you had a surgery?
So I'm 13 days out from surgery. I had surgery on the 23rd of August.
So you are now my case study.
All right.
Okay. So you tore it, when did you say?
May 8th.
May 8th.
Yeah.
And so talk to me about your process of your doctors. So you know the special doctors that know their stuff. Go through the process for me. Talk about you, which is great.
Yeah, I mean, so it's always interesting, right? And I'll back up a little bit, right? Just so I can sort of go into how, from a selfish standpoint, again, technology and telemedicine has started to play a role in what I do and things I talk about. It always frustrated me going in to see my colleagues, right? And being there for an hour, or being there for 2 hours, or the fact that somebody knew that I had an appointment, and I would call, and I'm that guy, right? I'd call and say, hey, can I get my paperwork? Can I fill this out? I got to get this done. And then you still get there, and there's still 15 pages of paperwork, and it has my
Right.
social on all of them. And I stopped putting my social on any paperwork over a decade ago. But I think when this happened, and I knew that something was wrong, because I'd torn my meniscus in my right knee about 20 years ago. I guess I'm dating myself. But I knew something was wrong. It didn't feel well. I couldn't go upstairs. It was getting swollen like a balloon. And so I actually called a friend in Minnesota, actually, a sports guy, and I was like, hey, take a look at my knee. And so we actually did FaceTime, right? And he looked, and he was like, well, bend
So
it.
literally with your phone. So I want to have people at home visualize what you did. Excellent. Let's do
Got my
that.
phone
Let's go to
out.
the camera. Got the phone out.
Got my
This is
phone
what
out.
you're doing. Yes.
I literally launched it, called him, I was like, dude, what's up? Hey, I think I did something to my knee. He was like, again? I was like, yeah, just not go there. And then I literally straightened out and put my knee, and he looked at it, he turned it, I pressed some things, I bent, pushed, and he was like, yeah, I don't think it's an ACL. You probably did tear your meniscus. You need to go get an MRI. And so from there, and that's synchronous.
And that in and of itself is such a big deal, because
Yeah.
how many of us have been in that situation?
course, yeah.
How bad is it? And that's a question I feel like on this program I ask all the time.
Triage, basic triage.
Yeah, how bad is it to go to the doc? Should I hang out for a couple of weeks and we'll see what happens? That's perfect. That is a perfect, and that's why I wanted to bring that up too. So from there you did.
So from there, so that's a synchronous visit, right?
Okay.
So real time, person to person, trying to find out what's wrong then. From there, I took a picture and sent to a local doc, local sports medicine doc, and said, hey, I think I've torn something in my knee. What should I do? He texts me back, says, well, come into clinic. So I go into clinic, get my injection for pain, first of all, right? Because it was swollen, it hurt, kept down the swelling. Did PT for another couple of weeks, and I texted him again, hey, send another picture. And all this concept I'm talking about is asynchronous, right? So I send it to him, he gets to it when he gets to it,
Gotcha.
he responds when he responds. It's not a real-time, direct back and back flow. And those are the two types of telemedicine, synchronous and asynchronous. And so he finally says, go get an MRI. And then from there, he went down the process of doing PT, got the MRI, got texted about my results, and then finally had surgery.
And finally had surgery.
Finally had surgery.
And so now, after surgery, you've had it several days ago, a
Yep.
couple of weeks ago.
Yep.
Are you now, again, wound care, all that kind of stuff? You're a doctor, so I almost feel like it's not fair to ask, because you know what you're looking for. But say there's someone who doesn't know
Yeah.
what they're looking for, and the scar is looking kind of puffy. It maybe there's some fluid coming out. What's going on now? Is that another time
So
and place
I'll tell
that you
this.
can?
I would have hoped that by now, at least one of the PT organizations or the wound care organizations in El Paso was there. I'm not aware of any. If you are, let
Yeah,
me know.
there are. There's one in our
In your network.
in our network.
Exactly.
Who is using it, and they use it for knee pain.
Exactly.
Okay.
They
Exactly.
they feel that a lot of the orthopedic surgeons are the ones that get knee pain first, and the surgeons. I'm not an orthopedic surgeon. I don't speak for an orthopedic surgeon, but at least what I hear is that the PT feels that they like to operate and won't send to PT first, and maybe it's not surgical to begin with. Maybe you just
Right.
need to see some physical therapist.
Okay. So let's, I'm going to take the angle now and not talk about audience members or patients. I'm going to take now the angle of doctors. And
Can I
yes,
jump
Dr.
in there?
Lozzi, yes.
So just to finish that sort of arc that we were talking about, right? So in some of the other cities in Texas, whether it's Austin, Dallas, San Antonio, or Houston, there's some physical therapy places that do home PT via telemedicine, right? And so you
Okay.
have to remember again, and I hate to talk about the finances of medicine.
No, but it's
But
real.
again, in a lot of surgical conditions, you have a bundled payment. You get paid X whether the person comes in 10 times
right.
or 100 times or one time. It behooves an organization from a cost-benefit standpoint not to have that person come in because they use resources.
Right.
They use resources, and they may be non-sick resources when you can use them for sick resources. So if you get a $2,500 bundle, if you have iPads that you can recycle and you've bought 10 of them, and when the person goes home, you give them the iPad, you say, hey, we're going to call you XYZ days, you do a wound evaluation via the iPad or the phone, whatever it is, on whatever system, whether it's Vemidoc or another one that you have. Ensure that the patient's comfortable, the wound person is comfortable, the PT is comfortable, and then transition them into home PT. right? And you can do it with videos that are set up. And if you need to say, hey, I need you to do XYZ over 30 minutes on a Tuesday, I'm going to record it. I'm
Bingo,
not gonna
that's
talk
what I
to
was
you
gonna
right
ask about that.
then,
Okay.
But I am going to review it and call you. Or I'm
So
gonna
there is
review
still
and text you.
accountability
Yeah,
with the
totally.
patient, that they can't
Totally.
say, oh, I did my 30 minutes,
Yeah,
because
no,
physically there you have
Yep.
no choice. There's someone pushing you. So that is recorded.
Yep.
And that's I get to it at 3 in the morning when I can't sleep, the doc,
Different
correct?
people
So
do it different ways. Some people do it live and synchronous. Some people do it asynchronous, where
Okay.
they just record it and send it off to the physical therapy team. And then they have a team of people that review it when they come in the morning. And they'll call you, say, hey, you're doing XYZ. I want you to twist the knee a little bit, or make sure that that foot is flexed up, right? So we can get that hamstring pull and that calf pull. I'm talking about myself now.
no, but this
yeah,
is
exactly.
real. That's why I wanted to talk about this.
And again, I think part of the issue as we dive into does telemedicine work, part of it is momentum, right? Inertia. The healthcare community here and other places in the country has the inertia of not doing it, right? So they haven't found what's the use case? What's the business case? And people always say, I'm too busy. And I say, yeah, that's great. You are too busy. But you know what you've also hired? You've hired a nurse practitioner to cover a third of your patients. Or you're doing XYZ in the hospital. Imagine if you brought in telemedicine, triage the people that don't need to come in and hold up those spots. Because
Right.
again and again, we don't want to talk about insurance all the time, but somebody comes in for a non-sick visit to level 3, maybe a level 2 at most.
Right.
But if you can ensure that you're getting 4s and 5s, docs out there will understand, you're getting sick patients coming in. First of all, from a financial standpoint, it's much better.
Right.
Secondly, I always tell people, right, in as much as we want to give the best care possible, we're most stimulated when we have a sick patient, right? I love all 1,300 of my patients living with HIV and hepatitis C, but the ones that stimulate me and the whole clinic's, what are we gonna do? And you gotta call this person, the other person, what's happening in the hospital, are those that come in sick.
Right, exactly.
Those that are coming in dying, and that's what tests your clinical ability. That's what really tests the limit of your education in being a physician. Right? And so I think there's a host of ways that telemedicine can help make the healthcare process more efficient, make it more amenable to not just the patient, but the provider, right? Really get them to enjoy the utmost level of their training.
And I love the idea that when somebody really is sick, that the emergency room or whatever is not going to be full of people who could really wait 5 or 6
Exactly.
hours or
That's
5 or
right.
6
Exactly.
days from there. So let's talk, Dr. Maspons, about how do I say this without being an advertisement? But let's talk about your conversations that you may have with other doctors or with other providers to try to not talk them into, but try to show them how the benefits are of putting this together, because it's got to be a two-way street.
Yes.
Right. The doctors have to be, yeah, this is a good thing. What is it? What are the conversations you have with other docs?
Initially our customers were physicians.
Okay.
And we ran into a lot of walls with physicians because they get paid a certain way. They get paid by seeing patients. There's a flow, and they understand the way money comes in. Why do they want to introduce new variables into that money stream?
Again, systemic.
It's a systemic thing.
Right.
And the future of medicine is not, that's called a fee for service. So if a patient comes in with an illness, the doctor fixes that illness, they get paid. That's fee for service. That's not the future of medicine.
Right.
Future medicine is quality. What can you do, Dr. Lopez, Garcia, whoever, to keep your patient panel, your 2,000 patients, out of the hospital? The most expensive cost for the healthcare system, hospitalizations and ER visits. So what can you and your clinic do to keep that patient at home healthy? And that's when they have to be creative.
Right.
And so we know that's going to happen. And so right now we are approaching hospitals and hospital systems and clinic systems and insurances. And they're the ones that really want to drive this because they want to save money, but more importantly, they want to keep patients healthy.
Right. And it's a change too. Everybody's got the fear of the unknown.
That's right.
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 And so as this is going on, and Dr. Lozzi, the reason I understand that you're not in that position anymore, but the reason I wanted you to talk about this grant and the idea that the world is changing and there is acknowledgement to that fact. And research has to have happened in order for someone to open up the purse.
Oh, definitely.
And so going into that, I would love to, we're kind of like at the 18-minute mark. So I want to ask this question first before I go into, hey, what we haven't talked about yet.
Yeah.
I would love for you, Bones, Dr. Spock Bones guy, where do you see this very particular situation a decade from now? So 10 years from now, in your best guess, taking into account that fear of change, but 10 years is a good amount of time, but it's also just a minute at the same time. Where do you see this in a decade?
So, I mean, sometimes they say plagiarism is the best form of flattery, right? And so I'm not taking this just from my thoughts or my knowledge, and I've been blessed and lucky that I'm the chair of the eHealth Advisory Committee to the Commissioner of Health and HHSC. I'm also the co-chair for the Texas Medical Association's Health IT Committee, right? And so a lot of people there are thinking about, really smart people, way smarter than me, thinking about this. I think the first thing that we'll see is that it's not called telemedicine. It's called healthcare, right? And the same way, once upon a time, the physician went to your house with a black bag, and you called that healthcare, it'll be called healthcare.
Right.
And the same way, once upon a time, it was only a physician you could see. Now we have PAs and MPs, and there's a host of other members of that healthcare team. It'll just be called healthcare. I pull people back that can remember, and I've been in El Paso about 10 years, but on the corner of Red and Wrestler, where there's a Walgreens, right next to it, there's now a meat shop. That meat shop used to be a Blockbuster.
Right, good
I mean,
point. Goodness gracious.
nobody really realized when Blockbuster went from sending those blue and yellow envelopes to not sending them anymore because they were bankrupt, and Netflix was sending them, and then Netflix went all digital, right? There are transitions that happen.
And we're all used to it now.
You look back on them, and you're like, wow, that's amazing. But in real time, it just happened because it was chipped away. I think to focus on your question specifically, I really do believe 10 years from now, healthcare will look different for a host of reasons. There'll be different levels of technology. There'll be diagnostics that can fit in your phone. There are diagnostics right now where I can do an EKG in my clinic, and I do it often. That's as good as a standard medical grade EKG. I have an app on my phone and the connection in my clinic that actually is better than a stethoscope. It's been proven multiple times. There are dermatologists that I know in town are using various artificial intelligence mechanisms to see patients online, send in their pictures of their skin lesions, and they'll make a diagnosis, charge them, and they don't have to come into clinic, right? And so again, I'm a public health guy, so I think about when you think in terms of equity, the reality is that the first phases of that are all based on your ability to pay.
Right.
But that's how our economy has always worked, right? The first people that had phones were doctors and executives. They had the brick. It cost 50 grand, right? And now it's ubiquitous. It's all over the place. Right? And so I think that leading edge, or that bleeding edge of people that are using it will flesh it out, proof of concept it, and scale it. I think, as Aldo has mentioned, organizations that are really focused on value-based care, quality care, and ensuring the patient experience and the physician experience have to start looking at telemedicine, because there are too many variables in our health system that cost too much money, right? And I mean, I've done some work in Austin with an organization there, and they piloted it about a year ago. They did it with only their ortho group. And then their OBGYN group came and said, hey, wait a second, what are they doing? We don't want to see all these people in for postpartum wounds, post-pregnancy wounds. Why can't we do that online?
And or your monthly visit before you go.
And they shifted 80% of their post-pregnancy wound checks to an online process, right, to a telemedicine process. And so people don't come in unless they're actually sick or have an issue with the wound, it's oozing, something else is going on, right? And so I think that sort of, I won't call it segmentation, but that sort of breaking apart or hybridization of healthcare is going to start to happen more and more. Aldo and his group are going to help people understand that this is something that they need to look at. Healthcare systems are going to do it. And I often tell COOs and CEOs, if they care to listen, they're like, well, we don't need to do that right now. We'll worry about it in 5 to 10 years. And it's the McDonald's approach, right? We always laugh, but McDonald's is running ads all the time. By the time your kids, if you have young kids, are 3, 4, 5, all they talk about is a Big Mac or a hamburger or a Chick-fil-A. It's brand recognition. If a healthcare organization in this city is serious, they need to do this now. And even if it's 5% of their margin, 10% of their margin, over a 5-year span, they become known as, oh, that place that I can get in easily.
Right.
That place that I can get seen by an excellent physician to get excellent care on my terms, right? A decade from now, when that 16-year-old that's living in your house becomes 26, has 2 or 3 kids, he's already got the muscle memory of, hey, I went to XYZ system because it was efficient, easy, and excellent for me.
Right.
Right. And they're not trying to recreate the wheel all over again. And again, these things are going to change. Like you mentioned, the law in Texas changed recently. I can't remember the Senate bill. I think it's 1130, but 1130 now says that you don't have to have an in-person visit before. It's also allowed physicians that want to get into telemedicine not to have to use the platform of the payer. So up until this last legislative session, if you wanted to work with United or Blue Cross or Aetna, you had to use their app to do a telemedicine visit. We lobbied, we said, hey, this makes no sense. I mean, I'm the physician, I get to decide what I want to do. And the legislature agreed, it's been signed by Governor Abbott. And so now you choose your platform, you see your patient on your terms, right? These are the things that are going to change, and it'll be incremental. But 10 years from now, it'll be a process where we don't even remember what happened back in 2018, 2019. It's just healthcare.
The great analogy is a Blockbuster. I think that's going to be the thing that sticks with me, because really, I don't even know how many years ago that was, but we were every Friday night Blockbuster. So I respect it so very much. We are like at a 12-minute mark. So what I want to do is, there's so much to talk about, right? Goodness gracious. So Dr. Maspons, when you were driving over here, and 2.5 years ago when you opened up your business, what is it that you want to get across to the audience that we may not have talked about yet? Because I know there's a lot.
Yeah.
It's something that either you want to touch base on a little bit more, or something that we haven't touched base on yet.
I want to see if I can do a demo.
Absolutely.
Is that
yes.
okay?
Heck yes. So it would be probably this camera. If you want to point anything, so it would be this camera that you're going to be showing.
So this is my phone. This is a physician phone.
Okay.
And I'm just going to show you how it works here. I don't know if you can zoom in that close or not, but
He's working on it. There we go. Okay. Nice.
Okay. So HIPAA compliant. So we have to, every time you log in, you have to put in your code.
And I'm going to ask you to do it a little bit up and down.
Okay.
That way the glare won't hit it. Okay, good.
So those circles, for my patients, I use it as an as-needed basis, and that circle represents an appointment that I made today.
Okay.
And I can also go to my schedule, and I can open up my schedule by tapping there, and then let's add on some slots. So this is my availability right now, and I can add some slots to that. Let's do it 8, and let's do 20 minutes.
You're good.
That's okay. So now, oops. Hold on 1 second.
It's all good. I love this happens to you too.
No, never.
It's everybody's Wi-Fi.
I feel like I have meat fingers sometimes when I'm touching my phone. It's like, why isn't it working?
Okay, so now I just opened up my availability for the rest of the day,
Okay.
and then.
No, you're good. The cameras are,
Okay.
don't listen to them talking.
Okay.
They're just trying to get all the
All
tech
right.
stuff done, but you're good.
So now I'm gonna just call somebody, and I'm gonna call my CTO. I'm not sure if he's gonna
Okay.
answer or not, but and so here I can click on the appointment, and so you can see who this is
Right,
and what the date
okay.
of birth is. This is a made-up patient.
Okay.
And then the reason for visit, and then just call.
Okay, and there you go. So there goes a call going through.
I'm not sure if he's gonna answer. But anyway, so.
But either way, you know it's right there.
Yeah.
And so how long do we spend on that? A whopping 2 minutes, if that?
If that.
If that.
In fact, I would actually say I dare any clinic in this city to make an appointment in under 2 minutes. I'll give them $1,000 tomorrow.
Yeah, that's true.
If they can make an appointment
Right.
in under 2 minutes, I'll give any clinic in the city $1,000.
And the
Because it's
person-
not possible.
That's right.
Possible. You're
not
on hold for a
possible.
minute. You got to
Yeah.
look at their calendar. You
it's
got to
not
look at your
possible.
calendar.
Exactly.
You already know what you have on your calendar before attaching it
And so
through.
that's the challenge, right? He's
Right.
proven what the benchmark should be, what the benchmark can be. And so that's the challenge in a very nice way that we throw out to our provider friends and the healthcare organizations in this city. Do better because you can do better, because the technology exists to do better. And it's not about you. It's not about your egos. It's not about eminence-based medicine. It's about patient-centric excellence.
Right.
That's the striving point that we should have. Our patients deserve better. Our patients deserve the best care possible. He's proven that it's doable. Let's follow the trend.
And I feel like you're like more in your head at that particular time than waiting. You know, there's 50 people in the waiting room, and I got to get through them all. But this is like specific allocated time for that person.
That's right, and it makes for a more focused visit, because a lot of times people they wait in the waiting room for 2 hours. You're pretty upset when you come into the doctor's
Right?
office.
Yeah, you're in a mood.
And you're like, man, and everybody's got to like, oh man, I can't believe your staff and all this stuff. And then you know it's 10 minutes to be like, listen, let's focus on why we're really here. And
Right.
now it's just to the point.
Yeah. And again, that goes back to the humanness of it. When you were
Yes.
talking about your niece and you were talking about the family, and I loved this case study that you were talking about with the boy that had a feeding tube.
Yes.
And grandmother wasn't grossed out by it. You guys talked them through it. How often, and I guess that's where I was coming with earlier, with advocating for yourself. If you know how to fix things on your own, then again, savings of time, savings of money, et cetera, et cetera, et
Patient-centered
cetrer.
care. That's the future.
That's the key.
Patient-centered
That's
care.
the key.
Patient-centered care.
Right now, we have a physician-centered healthcare system. You come see me on the west side. You come see me. I'm gonna show up to the hospital when I have time.
Right.
That's the way it is right now.
right.
It shouldn't be that way.
Yeah.
Right? You get groceries in an instant, food delivered to your house in an instant. Healthcare should be the same.
Right.
I always feel that if you're getting better service from a restaurant than from your doctor, something's wrong.
Yeah, there's something issue there. So, Dr. Alozzi, what have we not covered yet, or something that you want to bring across? We've got 7 minutes before the show wraps up, so we've got plenty of time.
Yeah,
but
I think for me, the key is for those of our colleagues that are out there, they're like, whoa, this is way too much. Don't be afraid, right? You don't have to do all of it. You don't have to do everything all at once, but take a look at it, dabble, right? Figure out, are there ways that you could be more efficient? Are there ways that you could make your blood pressure and your adrenaline that's rushing over an 8-hour clinic session a lot lower? Could you be happier in this process, right? I used to have partners, two guys that were coming to me, one had HIV, one did not. And they moved. So one moved to Minneapolis, interestingly, because I grew up there, and one stayed here. Because both of them were not together, we could never schedule them for an appointment, right? And so then when we opened up telemedicine, I could see them synchronously, and they could both log in at the same time.
Right.
And so I'd have two of them, one of me, do the note, both notes, we'd talk. They were so much happier.
I bet,
Right?
yeah.
And I was so much happier because that stress of being called every 2 or 3 months, I don't have an appointment and I'm out of meds, I mean, that's stressful to me and the whole clinic, right? And so again, I think that even if telemedicine is not something that an organization or an individual wants to do now, I'd say that they should go on the TMA website if they really have questions. TMA published a white paper last fall. We're updating it next month. I mean, Aldo's group is available, but I think you dip your toe and
Right.
you really look at how do we do this for the healthcare organizations that are out there, the Burrells, the Texas Techs. I think that you're doing your students a disservice, a very big disservice, if you're not training them on how to do telemedicine in 2019.
And we have 2 medical students here right now too. Did your guy finally
Yeah,
they answer?
so-
Hey, look, there's the appointment and
I
the
know
guy's on the
him.
phone. There you go. There's our
So-
demonstration.
Yeah, so this is our CTO. Right now he's in Austin, Texas. So this is what a visit would be like.
Okay, so he's talking. Hey, pointing over here. Hi, I'm hosting a TV show. I don't have any medical issues right now, but I appreciate.
Both part of Sabine, Texas, which is outside of Austin and San Antonio.
Nice to meet you, Austin and San Antonio too. So got patients everywhere.
Bye,
Love
JP.
that.
Thank you.
And we have 2 medical students right here too that we're going to have a conversation with. This is all done because they're in multiple years already with their education. And when I'm thinking too, and I'd like to expand a little bit, education now. We're talking about medical students who are 22 to 27 years old. Naturally, just in their
Digital natives. They're the
residencies.
digital natives.
Talk about what's going on.
Yeah, I mean, ideally, right, when they're in their first and second year, they're already having a conversation in their physician and patient, physician and the public conversations about how does technology impact healthcare? How is it going to change healthcare before you leave this institution?
Right.
How is it going to change healthcare during your residency and 10 years from now? I think people often forget that the medical knowledge that's learned and generated while they're in medical school is obsolete when they come out.
Yes.
Right? So
And you want, as a patient, you want your doctor to be innovative.
Exactly. You want them to understand what's going on, be innovative, and be able to see a little bit forward, right?
Right.
And so I think from an education standpoint, you want to make sure that medical students and residents and fellows are learning how to use these tools, right? Different places use it differently. Some will use a backdrop and say, hey, anytime you have a telehealth visit, you have to use a backdrop. Some are more catch and go, right? If it's a mobile app on your phone. And there's no right or wrong,
Right.
but you got to figure out what your recipe is, right? And what your organizational appetite for telemedicine telemedicine is. But I think, again, we have to train the doctors of the future, or we're not just doing ourselves a disservice today, we're doing ourselves a disservice 5 to 10 years from now, right? Because when those things start to change, that's going to be a defining characteristic. When somebody wants a job, they'll be asking you, hey, what electronic medical record do you use? Do you know how to do telemedicine? Have you done telemedicine before? We do 25% of your bonus on telemedicine. You've shot yourself in the foot if you don't have the ability to engage in that world that's coming. It's a competitive
And we
marker.
are constantly trying to recruit physicians
Exactly.
to El Paso.
Exactly.
I love what you said earlier. So TMA stands for Texas Medical Association. So you can go to tma.org. Yep. And when they go there, in that particular search engine, would they put telemedicine?
They type in telemedicine, it'll pop up. It's one of the first 2 links, and there's a telemedicine white paper that was pushed out last year at Fall Conference. We'll update it again this year.
I'm going to look into this myself later, white paper. And are there any other websites off the top of your head that you can think of that might be cool to look into this? Because this show's ending in 3 minutes, and I'll tell you in a minute how you can watch the show back. But and I'd like to get your website for your particular place, so throw that out right now.
Yeah, vemidoc.com.
Okay, spell it.
V as in Victor, E, M as in medicine, I, D-O-C. Vemidoc.
Vemidoc.
Yeah,
And
dot.
.com, .org?
.com.
.com. All right. And again, TMA, which stands for Texas Medical Association.org. You can also search engine that.
Yep.
Any other place?
I mean, the American Telemedicine Association, it's called ATA.org. It's a great resource for people that are interested in telemedicine. They have a bi-yearly conference. They just had one in New Orleans. I'll be going to the one in fall in Philly, and yeah. There's a lot of
Okay, again,
options
the
out there.
American Telemedicine Association. That's great. .org. So if this is something that interests you, American Telemedicine Association.org. And again, VEMIDOC, M-E-V, excuse me, slight, clean, V as in vacuum cleaner, E-M as in medicine, I, and then DOC.com. Dr. Alozi, Dr. Maspons, I cannot thank you enough for being on
so much.
this
Thanks for your
program. I have another story. I just had to go to the emergency room literally 3 weeks ago, and I totally could have avoided it if I could talk to someone who what was going on. So I think this is fantastic. Our next program is going to be September the 12th. It will not be the last September of the month as it usually, or the last Thursday of the month as it usually is. So I just wanted to let you know September 12th, which is next week, next Thursday, is going to be another show. But if you want to watch this particular program again, you can go to kcostv.org, and there you will go to watch programs and you'll find the El Paso Physician. You can also go to the El Paso County Medical Society website, and that is EPCMS, just think of that acronym, epcms.com. You can also find this on Facebook in the next 24 hours, if not 48 hours, because it sits on there for quite some time. And again, I want to say thank you so much to our underwriters. So we have Sunset ID Care and Vemidoc. Again, so I cannot thank you enough for doing this, because I would like to have this show again in 2 years. Because I think night and day different of what we're talking about now versus what people are going to be talking about in 2 years. I think that's going to be fantastic.
Billboards where organizations in this town are competing against, well, you can get a doctor like this, you can get a doctor like this.
No, I can see it. Again, I'm an old lady, but I can absolutely see my kids being all over this. So again, you've been watching Telemedicine on the Borderland, and we're going to be doing quite a bit more with that in the years to come. You've been watching the El Paso Physician. I'm Catherine Berg, and good night.